Today, I'm going to pose a simple question. Can design save your life? To answer this question, I'm going to tell you a few stories about how design impacts what we notice, what we understand, and the actions we take. I'll also give 3 examples of how partnering with information design experts has improved physician-patient communication, involved end users in human-centered designs, and has decreased violence and aggression towards staff in emergency departments. This is the coffee pot for masochists. It was designed in the 1970s by Frenchman Jacques Carmont as part of a series of objects known as the Catalogue of Unfindable Objects, delightful examples of everyday things that are deliberately unworkable, outrageous, or otherwise ill-designed. What it does is show how a misplaced handle deteriorates the relationship between the user and the object itself. If there was ever an interface between humans and design, it's health. One of the first people to recognize this important relationship was the German obstetrician turned designer, Dr. Fritz Kahn. After escaping Nazi Germany in 1941, Dr. Kahn published an entire book on first aid and the inner workings of the human body, using minimal words and maximal images. It is one of the first examples we have of the use of icons and images to display often complex themes in ways that people with low literacy or who were illiterate could understand. Fast forward from 1941 to 2018, the opioid epidemic is gripping BC and Alberta. Alberta Health Services launches free take-home naloxone kits with these instructions included on the inside. Look simple? Look again. These instructions were designed by healthcare professionals for other healthcare professionals, but the audience receiving these kits are everyday lay people with no training in what a quote-unquote muscular injection should look like. So a team of information designers got together with people who use drugs, their friends, family, and healthcare professionals to develop various prototypes using a human factors approach to test the various designs. The results was this paper insert, a new instructional pamphlet in the AHS take-home naloxone kit. The goal wasn't to make the world's best overdose response kit. What we set out to do was show that by improving the design experience, we could improve people's abilities to use a health device and hopefully save lives. This next project builds off the idea that effective communication between doctors and patients is central to health education and patient empowerment. Considering patients only retain 20% of instructions verbally given them by their healthcare providers, supplementary resources like paper handouts stand to strengthen the patient's ability to participate in their own healthcare, specifically to mitigate adverse outcomes and to help them understand when to seek more care in the emergency department. Enter yet another team of information designers, this time a group of students from Mount Royal University who are keen to apply data visualization and infographics to evidence-based emergency medicine testing and discharge instructions. The group revolutionized our largely undesigned paper handouts that you see on the left into tools that explained and informed conversations in graphic format about risk, indications for testing, and highlighted important self-management strategies on discharge. One last initiative used innovative information and visual design techniques that aimed to build on the relationship aspect of improving the patient experience by designing a tool that patients could use to better understand what to expect as they journey through the emergency department. This tool was co-designed by emergency patients using focus groups and then tested in 7 different emergency departments, including at a children's hospital, to make sure it was accurate and used phrases and words that patients would understand. This wayfinding initiative was modeled on a larger project done by a consulting group in the UK who found that the focused use of information design could firstly improve the patient experience, decrease frustration and aggression towards and among emergency department staff, and lastly, clarify the purpose and nature of the physical spaces in the emergency department that patients would find themselves in.